Mm. But isn't it designed uh, systematically by the government to erode the healthcare system in a way that people have to have long waiting lists, and they, if they are desperate, if you have a urgent operation, you go to Ontario, you go to the United States for heart surgery or something, rather than waiting in line. But isn't it created by the system?
I don't think it's that Machiavellian. I think governments of all political stripes would like us to have an excellent healthcare system. And friends that I have had traumatic health experiences, cancers, leukemia, uh, various accidents, have received the best health quality, best health care you could get anywhere in the world. Where our system starts letting people down is with chronic conditions, with mental health care, with procedures where you may suffer, but it's not life threatening. That's where you end up having to wait. That's where we need improvement.
So, in those shortfalls that we have in the medical system, who is responsible for making it better, for optimizing that service, so we don't have to go to the private market?
We all are, in the sense that, one, we need to understand the system well enough that we can form a political consensus that the politicians will want to follow. And ultimately, it's up to the politicians to act on that public will. But as long as people are willing to say there's nothing wrong with people paying out of their pocket, and too many people are willing to say that, then we've got a problem.
Okay, let's go to the number three question that I had here from nowpolling.ca. Provincial governments is the title, and the Minister of Health Services, and they say the availability of services or doctors or practitioners is not sufficient, and 52% or 75% actually say that it's insufficient, that we don't have enough personnel, enough doctors. Whose fault is that?
We have more doctors than we've ever had before.
Ah.
But one of the things that's happened is that an increasing number of the physicians are women. And whereas a lot of male physicians in the past used to work 70 or 80-hour work days, women are far more sensible. Women have a balanced life, and a lot of female physicians are working decent working hours. So when we talk about number of physicians increasing relative to the population, that doesn't mean that the number of person hours of physician care is increasing. I have a lot of empathy with this situation. I cannot find a personal physician. I'm using a walk-in clinic. On the North Shore in British Columbia, North Vancouver and West Vancouver, a lot of physicians won't take you as a patient unless you're willing to pay something out of your pocket for what they call their uninsured services, fees of anywhere from $500 to $1,000, which totally undermines the principles of Medicare. So what I do now is, I, like many people who can't find a family doctor, is I use a walk-in clinic. And that's atrocious, but I don't know how to fix that.
But then, are you saying that there is a shortage of doctors?
I think there's a problem in how we reimburse doctors. I think as long as we have a fee-for-service system, it drives the wrong incentives. I think we should have more physicians working on a salaried basis with a patient roster in community health centers, and that would change the incentives of how they operate. I had an instance with the physician that I left where I needed a flu shot and another exam. And I was told, oh, you have to come in for 2 appointments. Well, there's no reason to come in for 2 appointments other than for the physician to charge 2 fees. That's the kind of inefficiency and waste that needs to be routed out of the system.
So who will make that change in the medical service to have more walk-in or clinics, community clinics, as the one you're mentioning, and with salaried doctors and salaried labs with technicians? Who would make that decision?
Well, ultimately, that's a long, slow, gradual process that takes the cooperation of both government and the practicing physicians. We have seen more physicians on salary working in hospitals. hospitalists and various specialists. An increasing number working in hospital or on salary at the hospital. I think that's a good thing. We need to see more in the way of community clinics providing family practice doing the same sort of thing. There's historically been a lot of resistance to that, but you know, it may happen in the long run. I don't think it's the sort of thing that can be imposed. It has to be negotiated with willing physicians and a willing government.
Didn't Tommy Douglas impose his political will on the will of the doctors, and that's why most of them left Saskatchewan?
Well, he imposed public health insurance, but he didn't do anything on the doctors other than saying that public health insurance would pay their bills rather than patients out of their own pockets or private health insurers. But the doctors remained under the scheme that Tommy Douglas implemented in the 60s, self-employed independent practitioners.
Another topic that comes to mind is what does Medicare should include? And I think we touched about it a little bit earlier. And according to now polling.ca, it says you should include dental and sight and all those things. Now, most people would like to have that, would like a comprehensive system. But the government is not listening to it. And obviously, from the government side, they say, well, there's no money. How can we make that change?
What the government says, or what their actions indicate they are saying, is that when it comes to expanding Medicare to include more comprehensive coverage for pharmaceuticals, to include dental coverage, or to include other health services that are not covered, versus providing tax cuts, they think they are politically ahead to provide tax cuts, and that people who are most likely to support them don't mind paying out of their pocket for health, those uninsured health services when they need them, as long as they can have lower taxes. And until people who want comprehensive universal health coverage are willing to say, and for that, we should be willing to pay more taxes, it's a debate between those two extremes. And the people who want the tax cuts seem to be winning over the people who want more comprehensive health coverage.
Well, according to Seth Klein from the Center for Policy Alternatives, he says that most people in BC are willing to pay more taxes if they know that it is for health care. If they know what it is for, people are willing to pay more taxes. So it's contrary to what most people think, that people don't want to pay taxes. Seth Klein says, yes, people will pay more taxes. They're willing to.
My experience, both as an economist and as a politician, has been I had not met very many people who really want to pay more taxes, especially if they think the benefits of those higher taxes are to help somebody else, not themselves.
Maybe I'm just projecting my own wishes and your wishes. Say, sure, we should pay.
Because most people are willing to have other people pay more taxes so that they can benefit. And the challenge is to convince people that they should pay more taxes so that as a community as a whole, we can all benefit. That's a little tougher than my friends at the Canadian Center for Policy Alternatives would have you believe.
Well, do you believe now polling.ca has a little bit of a say there? Those a few people, those 20 people that have gone and answered and say, yes, we want comprehensive. Of course, somebody has to pay for it. So when they say we want a comprehensive Medicare, don't you think that they're saying, we'll have to pay for it too?
I congratulate you for a good start on a good idea with your nowpolling.ca. When you can publish the results of a truly random sample of 1,000 people on some questions for which they are properly informed, then it will have more political clout. It doesn't have a whole lot of influence with 30
people.
self-selected people.
I know. I realize that, but to me it is as random as anything else, because I don't select the participants in this poll. They come individually, so it could be a right wing or left wing, a communist, an anarchist, anybody. So it's in a way it is random.
No, it's not random in any way. It's just like the polls the newspapers and the radios run, where some people try to stack them occasionally, but they are in no way what any mathematician would call a truly random sample.
So you agree with most people that participate in this poll, and yet can we envision here what would be the solution? How can we get our wishes, the people that participate in this poll, yours and mine? How can we get these wishes become true? How can we do it?
It's a long haul to convince people that it's worth paying more taxes to have better health care.
I'm willing to,
Yes,
and
well,
you're willing to.
yes, you listen carefully over the months ahead, and you'll hear the government saying that healthcare is not sustainable, it costs too much, and
Yeah.
tax cuts have to come first. That's pure and utter nonsense, and they must not be allowed to get away with it.
Yeah, I hear that from the liberals as well as from the NDPs. I've heard that from politician NDPs that say exactly the same thing. We can't afford it.
Well, yeah, what you'll hear from the New Democrats is that there's resistance to tax increases, but we want to have comprehensive health insurance. What you hear from the liberals is healthcare is not sustainable. Fundamentally different issues.
Uh, is it possible to put a private member's bill by somebody like you and say, this is what we want, and please discuss this in the House whenever they get called back to sit in the legislative?
Rules of the legislature are that no private member's bill can be put forward if it involves spending money. So everything that we are discussing is out of scope, not allowed under the rules of the legislature, even for a private member's bill, because it involves spending money. No, there's no such. You can't even introduce a private member's bill. As for a referendum, you could organize a referendum, but to have a referendum requires a signature requirement that has only been satisfied once in the history since we've had initiative recall in British Columbia.
For HST.
Yeah.
Yeah.
The likely way to get these changes is by continuing to educate people of the benefits and usefulness of comprehensive universal health care.
We've been saying this for the past 25 years or more, and gradually we're eroding the system rather than getting it better.
I would say it's closer to about 40 or 50 years that we've been saying this, and it's interesting how much healthcare has changed over that 40 or 50 years. I would quarrel that it's gotten worse. I would say life expectancy has increased, that differences in health outcomes have diminished. We are making progress, but the only way we make progress is to point out where there are flaws and continue to put pressure on to fix those flaws. But we shouldn't throw the baby out with the bathwater, as it were, and condemn our whole system.
We should reform it.
Precisely. Continue to improve it.
And are you going to run again for MLA next time so you can do it?
I served my time. I find that I am much more enjoying being a political pundit than being a political punching bag.
Well, thank you very much for your time, David.
And I'm sure there'll be additional opportunities in the future when we see what the government does, but always full of surprises for us.
All right, thank you very much.